here today, so we're going to jump right in. We have quite a few individuals who will be presenting today. So let's just start by going over some information about today's webinar. We're certainly going to be talking about how we can prevent the spread of COVID-19. That's always going to be at the center of the work that we do. But we also want to make sure that our most vulnerable individuals are not falling through the cracks, that they have access to the essential health and human services that are needed. Now, we are slated to go the full 60 minutes here today, but we have built on an additional 30 minutes in case there are questions and answers. So, you're welcome to stay. We should be done with the presentations right at 3:30, but again, we can continue on for an additional 30 minutes if we need to. This week, you can use your chat to ask questions. I have myself and another staff member, Megan, will be monitoring your questions and we'll try to get those answered. We're going to have Dr. Alonso to come on first so that you can get all of the questions related to health answered, hopefully. And if you're having difficulties, then go ahead and try to log off and log back on using Google Chrome. This application seems to work best by using Google Chrome. We understand that many of you are working from home, and so we ask that you would mute your phones. For those of you who are presenting, if you are working from home, your phones are unmuted, so we want to make sure that you're aware of that, and if you can mute your phones as well until it's time for you to present. And we have posted our previous webinar on the website. This webinar will be posted within 2 to 3 days as well. So those of you who have friends who couldn't attend and want to get this critical information, you can have them log on to pdcgov/community services, and they can access this presentation. Our agenda for today, I just want to welcome all of you here. We want to make sure that all of our community partners stay informed about what's happening here at the Emergency Operations Center and throughout Palm Beach County. So I'll go over kind of a structure of why I'm presenting this webinar to you today and how that falls into the structure of the Emergency Operations Center. But I want you to know kind of what the overview agenda will be. We're going to talk about where we are with COVID-19 to date. We're going to have an opportunity to look at some federal, state, and local funding that's coming down and doing what we can to prepare for that. We're going to hear an update from our Department of Children and Families. It's a central part institution in our community. And we want to know the dynamics that are occurring with DCF and some of its partners, including the Southeast Florida Behavioral Health Network. So Ann Berner will be providing some information for us. And we want to keep our finger on the pulse of what's happening as it relates to employment and those who are unemployed and what we need to do about it. Many of you as nonprofit leaders and as businesses will be directly impacted by some of the unemployment that will occur. And we have some strategies that we're hoping to implement to get them reemployed as quickly as possible. And then, of course, we want to keep you abreast of what we're doing around our broad and comprehensive food strategy. And so Julie Crepo will be providing you an update on that. I mentioned the Human Services branch of the Emergency Operations Center and its function. And basically, whenever there's an emergency or disaster, and we're activated as a county, I moved from my role as director for the Community Services Department into the role of director for the Human Services branch. And that will just involve coordinating services for the basic human needs before, during, and after the disaster. And it involves, mass shelters. If there's a hurricane and people need to mobilize into shelters, in this case, it's isolation. making sure that people are sheltered if they're needing to isolate. Of course, food and water is usually always a part of that, and coordinating mass feeding sites, any type of medical assistance, crisis counseling, and really focusing on our special needs and our vulnerable population and our animals. And so you'll see where the Human Services branch falls within the operations section of the EOC. There are 2 or 3 other sections that are not reflected on this particular org chart. But I just wanted to give you guys an idea of what's happening and why we're facilitating these calls to make sure that we are operating as efficiently as possible. So with that, I'm going to turn it over to Dr. Alonso, and she's going to walk you through where we are to date with COVID-19. And then again, if you have any questions, use the chat button, ask those questions, and we'll have Megan and myself to monitor those so that Dr. Alonso can provide you with that information. So I'm going to move over and have Dr. Alonso present.
I think I'm just at the right height because you're taller than me. So as long as I don't look up, I'm doing good. Okay, well, hello, and thank you very much for joining us. I think most of you know me, and you know that to me it doesn't matter whether you're working in the health department or the county or United Way. We're doing this all for the same people, which is our community. So we're all in this, we're one team, and we have one mission, is to stop the spread of this virus. If you look at, I hope you can all see this well. I will try to use this little arrow to tell you where I'm talking. If you take a look at the county, let's take a look at the county first, and we look at this map here that has all these big circles. The bigger the circle, the bigger the impact. So we know that this epidemic started and spread to all the countries. That's what made it a pandemic. Once it spreads to all the countries in the world, then you call it a pandemic. And it started California, Seattle. You still see large numbers there, but Seattle in particular has been the state that has really flattened the curve. And you're going to be hearing that term a lot, because that's when we achieve stopping the spread of the virus, when we're able to flatten the curve. So I'll be talking a little bit more about that as we go along. So you can see that in terms of cases by counties and cities, New York is way up there, really very severe. And that makes sense, right? Because the more dense a city is, the more chances you have of spreading the disease. The more spread apart you are, you have less chances of having a lot of cases because you don't run into people. So if you look at Montana, there's not a lot going on. It's still there because the virus is very adept at spreading from person to person. So they do have cases, but you're not going to see the cases that you see at a national level in very dense cities. When you come to our county and to the state, how do I go to the back one, James? And down here?
Yes. So what do you want to do?
No, I messed up. Let's see if I can go. Previous. I go previous again. You look in terms of the states, you see the tri-area, New York, New Jersey, California, Michigan's having a lot of problems right now, and then comes Florida. And you see Washington has gone way down, where they were a big center before, especially Seattle. So it is possible that by using the social distancing, which is the only tool that we have in terms of pandemics, no matter how far we get along in science and how fancy we are. The only tool we have to a pandemic, because there's no medication to take care of it, and there's no antivirals, the only tool we have is a social distancing. So the sooner you start social distancing, the sooner you get that under control, that the community really understands what you want them to do, the more success you're going to have in doing it. So that's exactly what South Florida, Region 7, we're saying we're one region, one voice, one message. That's what we're trying to do. All the directors from Miami, Broward, and Monroe, as well as myself, are together in this, trying to promote that one message that we're trying to get for social distancing. So here we are in the county, and if you go to each of these counties, I will learn how to do this. The numbers pop up, so you're welcome to go on this. You can go on the floridahealth.gov and you go to Corona, and these charts will come up, and you can utilize them. So as you click on each one, it gives you the number. So right now we're highlighting Palm Beach. So we have 630 cases, 22 deaths with 85 hospitalizations. You can also look at the number of cases per day that the state has as a whole. But you can see that right here in this lower box. And you see that they're going up, but they're not going up straight up like they are in New York. They're kind of taking little steps. That's a good thing. So Florida, yes, it's increasing in cases, but not like New York, not like New York State or New York City specifically. This is a very important chart. This is something that we're doing out of epidemiology. In this chart, what is important is that we see these cases going up, right? You see them climbing. This is the cumulative number of cases that we have. So this is up to our 630 cases that we mentioned earlier. But what's most important is this little orange section. This is what we call the delta, or the change from day to day. So at the beginning, we were on a linear curve. That means that they're going up 1, 2, 6. You see them going up very slowly. So almost like flat line. And then you start going up the curve. When this starts going exponentially, when you start doubling the numbers, that's when you get in trouble. That's what you're seeing in New York. We are not doing that. Palm Beach County is not doing that. Yes, we grew here. We had a few steps that grew quite a few numbers, but you don't see anything doubling. And as a matter of fact, on here, on the first, we actually saw a decrease a couple of times. So you saw 39, then it went up by 9, then it went up, it doubled there on that one. We were getting a little scared there. But then you saw just 1 and fewer cases. So we've had a couple of spots here where we had fewer cases than the time before. When you get to a point where you're only going back to 1 or 2 or less than 1, then less than doubling, that's when you start flattening the curve. That means you have less transmission. Instead of 3 people for every 1 case, you start seeing 2 people. When you get down to 1, you really flatten the curve. So that's what we're looking for. And we're tracking this very, very closely. Our social distancing is working. And if we are successful in making everybody participate in this, we can flatten this even more. That's the goal. So the more we can get the word out, the more people can actually understand what that means, the better job we will do in meeting our objective to decrease the virus. Didn't do anything, James.
It should be. It's got a short.
Okay. So another thing that you can do is to take a look at your cities. And you can actually, this map is a map of Palm Beach County. And you can see that the darker the purple, the more cases we have, right? So our big hot spot is down here in Boca. Does that surprise anybody? Why? seniors, right? That's where we have a big congregate of senior living. Why is that so important? Well, because they're the most vulnerable in terms of people that are actually going to die. They have morbidities, they have other conditions. And then, of course, we have our other areas that you're concerned about in terms of whether it's mental health issues or housing or other people that we're very concerned about. So we have to take care of everybody. We can't just concentrate on Boca, or we can't just concentrate on Del Rey. We have to do things that are going to try to take care of all these groups. So we have our first site set up, our first drive-through site, which we thought was going to be a very, very important thing to do, and it is. But we're also getting ready to do our second site specifically in that Del Rey Boca area. See, it's not me. It will turn. He says it will turn. We're clicking like crazy here, trying to make this go to the next slide. Okay, so you can also look on here if you want to take a look at the age groups. Now, remember, we had that little girl that was 5 or 6 years old, so those things kind of skew your averages. You can also see the people that are hospitalized, the number of deaths, male or female. For a while, the males were 2 to 1 to females. Females are catching up. As usual, females end up catching up and going above the males pretty soon, so we'll catch up eventually. And you can also take a look at your county. So Dade has more cases, but in terms of the facilities, that's an area that we're very concerned, because you have people living together very closely. It's very easy to spread viruses in a facility. Broward has the highest, 26% of cases in long-term facilities have occurred in Broward, followed by Duval, which is Jacksonville, and then Dade, and then we're at 12%. We're trying desperately to keep that number as low as possible. We have people out there right now visiting long-term facilities, trying to make sure that they have PPE, making sure that they're not cross-contaminating. We're even looking at the workers to make sure that somebody who's told to stay home does not just go to another facility and start working, because if they don't work, they don't get paid. And that's something that happens sometimes in nursing facilities. So that's something that we're looking at. This was the site. I'm very, very proud of the healthcare district. They actually set this up totally self-sufficient. They followed the plan that they had out at Lantana that they were doing out of their mobile coach out there, and they actually put it on steroids. The governor promised to have the testing samples of swabs. Their dentists were the ones actually doing the swabs. Their nurses were doing screenings. They had their runners. They had other staff there. The National Guard that was brought in basically was doing the traffic control. The National Guards at other facilities were the ones doing the swabs, but the healthcare district wanted to do their own swabs. Because they have an electronic medical system that does both appointments and tie into their patients, they were able to give everyone appointments. So when they got there, they were already registered. Their samples were able to be barcoded and put right into the packages already pre-labeled and ready to go to the lab. So they were very, very efficient. They had 2 rows of people going into the tents, actually 3 rows, and this facility with the field and everything is just perfect for this. I mean, it was running really, really, really very smoothly. The other site that we're going to set up on the south end will be a little different. It will be run by a different entity, but again, using the same swabs that are being provided by the governor, and going to the same lab as this site, but being run by a different entity. So basically, the overall strategy is to test folks, track those tests, track the positive people, make sure that they're isolated, They either stay home, they need to, we call it, if we tell somebody who is actually sick, that's called a quarantine. If the person is just being isolated looking for symptoms, it's called isolation. And that terms get confused all the time. It's okay if you use them interchangeably. The only person that has power to quarantine is actually the health department. So when the governor says he quarantined people, he really didn't. He just did an executive order, but that's a minor detail. So you can use the terms interchangeably, but basically the words we're using now is to stay home. Okay, we want people to stay home for the 14 days. The reason we're saying take acetaminophen is there's been a few things, a few people saying that non-steroid anti-inflammatories make things worse. There's no documented studies to prove that, but if there isn't, at least we can say acetaminophen and not worry about things that are coming up on the internet. The most important thing is to drink plenty of fluids and to get rest. There's no antiviral medication. There's no other treatments. Forget about everything that's on the internet. There's stuff about vitamin C. There's stuff about special medications and so forth. None of that has been proven. So right now, you just stay home, even if you're positive. So one of the things I tell people, it's not so important whether or not you get tested. You're still going to be treated exactly the same way. You're still going to be staying home, whether you're positive or you're negative. What's important for first responders and for people that are at work waiting to know whether or not they're positive so that they can get back to work. And so we're trying to be as responsive as possible to first responders, to our community workers and so forth, because we know that we need to get back to work. We can't afford to stay out because we still have essential things that we have to do. I cannot close my STD clinic. You cannot close your going out and reaching out to your homeless population and so forth. So these are functions that we have to do. And in order to do that, we got to keep our workforce healthy and get those test results as soon as possible.
All right. So thank you, Dr. Alonso, for that useful information. You can see there's a lot of monitoring going on here at the EOC. We're just keeping on the pulse of how things are operating out there, what's happening with our hospitals, our ICU beds, what's happening in our senior facilities. Just doing our best to make sure that any request that comes in, that we're able to fulfill them and keep everyone moving forward with slowing the spread of this disease. So now we're going to have Wendy talk to us about some of the federal, state, and local resources that have come down as a result of COVID-19. She's going to walk us through some of the things that are available and what the uses for those funding streams are. Wendy, can you hear me?
Can you hear me?
Yes, we can hear you. Go ahead.
All right. All right, good afternoon. So the first slide up, and I apologize, they're not real pretty slides, but they have a lot of information in them. Is the emergency shelter grant funding. It's a formula grant that's coming down to local governments. We just received word Palm Beach County is slated for $3.88 million. Probably the biggest changes in this, and with most of the funding that we've seen, is it removes many of the federal regulatory barriers, such as matching funds, procurement, habitability standards, environmental reviews, all things that have a tendency to kind of put the brakes on housing for a couple of days to a week. Those have all been removed. And with the ESG funding, they're practicing a housing first model. So it's not a condition of shelter that they're clean, that they're in treatment, that they're taking their meds if they're mentally ill, etc. It's not a stipulation. As you can see from the slide, the funding source pays for a wide variety of costs, including shelter operations costs, which is equipment, gear, any kind of gear that the shelters would need in order to maintain the health of their population and also their staff, room dividers for quarantine, cleaning supplies, and for street outreach, it does really the same. Gear, equipment, hand washing fountains, showers, anything that's going to keep our street population as healthy as it possibly can. One thing that's in here that was nice to see was it does pay for staff costs if we need to add staff, either to outreach teams, if we need to train staff on what a pandemic is and how to effectively deal with folks out in the population, and also prepare us to support the infectious disease preparation that's going on across the county. So it has a wide variety of uses. We expect it. They're saying in 30 days. So we'll see if it hits in the next, or a week into it. So the next 3 weeks. Moving on to the Community Development Block Grant. This is not a whole lot of information is out on the Community Development Block Grant yet. We know that we're slated for about the same $3.8 million. Will serve incomes traditionally up to 120% of the area median income. So we get into some pretty high incomes for the population that we're used to seeing. It does waive, again, many of the federal requirements traditionally used to build housing, and that with a 15% cap on public service dollars, which is rent, utilities, et cetera, that has also been waived, which we're happy to see as well. Next slide will show you that what it can be used for. And most people, I had somebody say to me today, why would you leave employment services in there for job training? That's not an immediate need. Well, it could very well become an immediate need. So I'd rather err on the side of putting everything in rather than just limiting it. This pays for services for senior citizens, services for the homeless, pays for child care costs, pays for child care costs for first responders, pays for additional health care, also does substance abuse services, not mental health, but substance abuse services, which I thought was interesting as well. So being able to kind of partner with Southeast Florida on that as well. Moving on to HOPWA, we have an undetermined amount of money that's coming in for HOPWA, which is housing opportunities for people with AIDS. This will cover rent, can cover mortgage, and goes to 24 months, which is also really nice to see. The caveat on this is it can't be used for permanent housing, so it's a transitional housing model that HOPWA traditionally uses anyways, but it can be used also to help pay for hotels for folks that are living on the street and need to isolate. Probably the most exciting piece of legislation in this bill is the Corona Relief Fund. This is a huge pot of money that's going to come down to states in a block formula, and it will cover any expense that was incurred due to the public health emergency. So it could be rent, it could be utilities, it could be supplies. We're expecting a minimum of $1.25 billion coming to Florida, and because it's based on a formula, localities with populations of more than 500,000 will be the target. So we are definitely in that mix. Also exciting is the moratoriums on evictions and foreclosures. This has a caveat that federally backed mortgages from either HUD, USDA, FHA, VA, Fannie Mae, Freddie Mac can be diverted for 60 days. effective March 18th, which was the day the bill was signed. Also, anybody that has a mortgage can request a 180-day forbearance. Has to be a federally backed mortgage, and then they can extend it for another 180 days. So essentially, you can ask for a year worth of relief on a federally backed mortgage. Multifamily owners, which we have a lot of in our community, can also ask for forbearance, which can be up to 60 days. The caveat to that is that the landlord has to agree not to evict anybody during that 60-day period, nor charge any late fees. And then evictions for renters who are in homes with landlords that have federally backed mortgages, same thing, 120 days, no evictions. So there's a little bit of relief there at a federal level. I think we were expecting it at a state level, but we got a lot of it in the federal level. I know there's been concern, on the next slide, concern on public housing authorities. And public housing authorities are sweating because they've already put their budgets in for the coming year. And now they've got many of their folks unemployed, which drops their amount of rent that they pay to the housing authority or to their landlord, actually. It drops it way down, so the housing authority will have to expend more to be able to meet that rent. This act, the CARE Act, actually takes care of that and puts a significant amount of money for public housing, for tenant-based rental assistance, and also provides funding to ensure that the housing authorities are able to care for the health and safety of their residents. I was just on a call with public housing authorities, and they're really scrambling around that. Next slide is something that's fairly new, Emergency Food and Shelter Grant Program, which traditionally we get in Palm Beach County, administered through the United Way. It's slated for a $200 million increase. Again, with the second bullet point, the states that have already requested declarations are going to be the priority. And this can also be used for people that are experiencing homelessness or for folks that are low income to maintain their shelter or their housing. Just out on this as well, which not a lot of information, that's why you won't see a lot of information, is the Health and Human Services Administration of Children and Families. $25 million on top of the current allocation that has not come out yet. $45 million to states to support child welfare. $45 million to DV shelters. $3.5 billion going into child care assistance to support child care centers who have either ceased and closed, or have seen a decrease in enrollment and can't meet their payroll. But it also pays for child care for healthcare workers, emergency responders, anybody that's deemed essential. So that whole list that we have of what essential workers are, this child care piece would allow the money to actually pay for those folks. Also, Head Start has a large allocation, and summer programs also have a large allocation. I'm really hesitant to think that we're going to have summer programs, but let's keep our fingers crossed. The next slide is $250 million to certified community behavioral health clinics. I spoke to Ann earlier and was very disappointed to learn that we have none in Palm Beach County and none in Florida. Emergency response grants, $100 million going to mental health, substance abuse. they're targeting youth, homeless youth, and also the homeless population. So it'll be interesting to see where that falls, and there's also some suicide prevention.
Dr. Alonso had a question for you, and then thank you, Wendy. We're going to move on to the DCF presentations after that.
Okay.
Dr. Alonso, there are some other questions, as you can see.
Okay.
They're asking about Palm Beach County's death rate compared to Miami-Dade and Broward. If you can provide
Sure.
an explanation on that as well.
Okay, the question I had for you, Wendy, is wouldn't the healthcare district that has a fairly qualified mental health facilities with the psychiatrist and the psychologist and able to take people on, wouldn't that be a place that we can refer people to?
You know, I don't know if it's a, you know, again, I spoke to Ann, and they have to be a certified community behavioral health clinic as designated by SAMHSA, and I'm not sure they are.
It won't, on the call, so
it won't matter if they don't have money, because they'll see them regardless of their ability to pay. So whether, I mean, we don't care about the money.
Maybe in the emergency response grant where there's $100 million, you know, that may be something they could tap into. But yeah, I would actually have a call with SAMHSA tomorrow. I'd be happy to answer that question.
What I'm saying is, it doesn't matter that they're getting money or not. I just want to make sure the community knows that we have places that they can
free. Yeah.
Yeah. Okay. So some of the questions that I have here, real quick. You want me to answer those first? Yeah. Especially the one about the more deaths. So if you do our number of deaths, which is 22, I think, on the last count, and you divide that by the number of people we have, our death rate is very high. The number of deaths has a lot to do with how the doctors and the medical examiners determine the death and whether they put COVID into the equation or not. So don't try to calculate our death rate based on that. That's not a fair judgment of what our death rate is. Now, we have more elderly in Palm Beach County than Miami per population. So it makes sense that we would have a little higher death rate in Palm Beach County than, say, Miami, who has a younger population. But that number that is 7 in Miami looks way too low. That's the same thing that happens with overdose. If you saw when we started our overdose that we had more people dying with overdoses in JFK than all of Dade County, that doesn't make any sense. So you have to take some of these numbers not too seriously, is what I'm trying to say. We have to wait till for death rates and things like that, you really have to get large national numbers before you can start attributing those things. There was an article in CNN that said that coronavirus can spread through talking and even breathing. Okay, so everybody stop breathing. Okay, I mean, come on, folks. Now, if somebody is talking, and not to be funny, but I have been around people that talk and spit. So yes, I can see how somebody talking, maybe breathing very heavily, could spread the virus. But look, we're going to catch this by people coughing and sneezing on us, and you're going to catch it by touching a surface and then bringing that to your hands, into your face and mouth. So anything is possible. The other day on the municipal calls, they were talking about people that were blowing leaves, and they went on for about half an hour talking about the guys out there blowing the leaves, that they were aerosolizing the virus. And I said, you know, I could probably do an experiment where I spit on leaves and then somehow blow those into your face and blow the leaves into your face. So you got to take some of these things a little less serious. It's kind of like when we used to talk about HIV. You're going to get HIV by having unprotected sex, right? That's the bottom line. So we got to treat this the same thing. We're going to get this by touching surfaces, and we got to stop the spread by using social distancing. How accurate is the PBC data given the lack of testing, looking at the daily rates increase or decline? We're going to see a tick up in the number of cases as we do more testing, but I still I'm hoping to see that curve flatten out, because as we test more, that means we can isolate more people and keep them at home and keep their families at home. So overall, it will have a good effect in our objective of lessening the spread.
All right.
All right?
All right, very good. So we're very fortunate to have the DCF Southeast Regional Manager, Director Dennis Miles on the phone, and hopefully he's unmuted, and we can begin to hear from DCF and some of its representatives. We're going to go through this very quickly, but we certainly understand this is a major pillar institution within our community. We need to make sure that we are communicating with the Department of Children and Families. So we're going to hear a little bit about some of their economic self-sufficiency program, the adult protective services, and things that are happening there. And then we're going to have an opportunity to hear from Ann Berner, who's on the line, of what's happening in our behavioral health and substance use disorder facilities. So Dennis, if you can hear me, take it away.
Absolutely. Thank you, James. Can you hear me all right?
We can hear you just fine.
Okay, as you said, I'm the Regional Managing Director for the Southeast Region, which is composed of Palm Beach, Broward, and the Treasure Coast. We have about 1,100 employees, and in a 5-day period, we were able to move about 95% of them into a teleworking environment. We have remained fully operational at all times. I have with me today, because I'm going to have to jump off, I have a call with the secretary in just a few minutes. But here on the webinar today, we have Elisa Kramer, who is our Circuit Development Administrator. I'm sure you know her well. And then we have our program directors as listed on the slide for each of our programs. And they will be able to give you a brief update on everything that's happening in their program. Okay, so that's all I got. Just wanted to say hello and introduce our folks. So we can go to Elisa from me.
Thank you. Elisa, can you hear? If you want to make sure that you're not on mute.
It was on just a second ago because I was talking to her.
Yeah.
Lisa, you there?
Stop breathing.
So if
We can go on to Sandrine. Are you on?
and Doris, if you're able to unmute them, please do.
I see that Elisa is there. Her screen is black, but she's showing up. She should be able to speak if she's there.
Okay, Elisa, can you hear?
I don't think she's there. What
Yeah, I
was
see-
the person's
I see it.
name?
Okay, and then Sandrine, what is it? Sandrine, can you hear?
Are you able to hear me now?
Yes, we can.
you go.
Hear you.
Okay. Sorry. This is Elisa Kramer. Can you hear me?
Hear you.
Okay. I really don't have a lot to bring. In the interest of time, our program directors are on the line and we do want them to present out, but we really do want to also express appreciation to a lot of the groups that are represented on the line. We have worked very closely offline and behind the scenes in partnership. And so we do appreciate that. As Dennis said, we are still fully operational. You hear from our child welfare side, self-sufficiency side, of course, Anne, and I believe Suzette Fleischman also is on the line to speak about behavioral health services that are continuing, and John Noby, our Adult Protective Services Regional Director as well. So available if you have any questions, but if Sandrine will connect, then we'll go straight to her, please.
Sandrine, are you here? Can you make sure you're not on mute?
I've just reached out to Sandrine. I haven't heard back from her yet. Robert Shea is on. Robert is our child welfare director, and he can give you a quick update on how family safety and child welfare is progressing during this time.
Okay.
Are you on?
I see Robert. Robert is on. He's not muted.
Can you hear me now?
We can hear you now.
All right. I was trying to use the phone, which would have been easier, then you wouldn't have got all the background in the house. So I just wanted to just go over a couple things. Welfare is still open for business.
Robert, you're not coming through very clearly, so I don't know if you can, maybe if your phone is on speaker, if you can put it directly to.
Is that better now? Okay. I just wanted to reiterate that child welfare is still open for business. We are accepting and receiving reports from our hotline for abuse, neglect, and abandonment. We're going out and investigating them. We are still transferring cases to case management, our CDC. Licensing and relicensing foster homes, group homes. We're still referring to our very high-risk families and family support services. The line has been screening calls for any symptoms, positive, pending results of COVID, any of any concerns, any subjects of the report, you want intakes. This is very helpful for our staff. Last Friday, we had full supply of PPE for our staff, Our headquarters provided a status document regarding the use of PPE, using the CDC and DOE guidelines for conducting on-site visits, since using our PPE, social distancing, conducting interviews outside if at all possible, using sanitizer, washing hands after each visit.
Robert, you're really sounding muffled. Really sounding muffled, so I don't know what we can do to improve your transmission, but we can't really make out what you say. And I see that Sandrine is having difficulty. So why don't we see what we can do to fix that for now? And I see Ann, you're on. Maybe we can just get to you and then work on these technical issues with Sandrine and with Robert.
Absolutely. Thank you, James, and Dennis for including Southeast Florida in the updates today. First off, I want to highlight the partnership that we have with 211. And what we're doing is making sure that all of the resources that have become available are being vetted and cleared through 211. They have a separate COVID-19 site where a lot of the telehealth resources are available. So I want to encourage everyone to share and pass that along as a very effective, a very real-time resource that can be easily accessed and has a great, easy to remember number. 211 is also working very closely with our mobile response teams. And so anyone who is experiencing any kind of crisis, and a crisis is defined as the caller defines the crisis. So whether it's emotional, whether it's anxiety, and they will be triaged through 211 and transferred if additional response is needed. We're also, 211 is also partnering with Mental Health America of Palm Beach County for individuals that are high anxiety but need somebody to talk to maybe for a little bit longer than a 211 operator would be available. So they're having a very effective warm handoff and being able to really maximize all of the telephone contact to make sure that we're following up and maintaining contact with individuals who have identified a high need or high emotional state so that we can prevent it from becoming a full-blown crisis. Our mobile response teams are going out to homes. They are taking the social distancing into consideration and using the appropriate PPEs, which we've all learned a lot about in the last weeks. We're working with our partners at DCF to make sure that we have an adequate supply to support both mobile crisis and our acute care teams. So right now, all of the publicly funded crisis stabilization units, including Belle Glade, are operational. We've had a very successful partnership with law enforcement who is identifying individuals who have any medical conditions and making sure that they have medical clearance before bringing them to the receiving facility. So we're very appreciative of that. DCF is monitoring both the public and private crisis stabilization units for capacity so that we can stay ahead of the curve and understand where and when, at what point our system begins to reach capacity. We've not seen a lot of staffing problems at this point. Have gone for community-based services do offer a telehealth platform. And so we've been very successful in a short period of time of converting to teletherapy, including case management. Most of our providers report that they are still doing new intakes. And so assessments are continuing. Again, on the 211 page, there's a number of resources for things like online AA groups and other. We continually update and vet all of those links so that we make sure that we have the very best and very high quality resources available to our public at large. But then we're also working very closely with our high need population and making sure that where needed, we've provided cell phones so that we can be in touch with them. We continue to monitor and engage clients for services and for treatment. All of our residential programs are still operational. We monitor and screen both staff and clients coming in. I think those are a lot of the issues going on. There's a lot of care coordination, especially for very high need individuals between the providers in Southeast Florida. So we're working to make sure that our most vulnerable are getting their needs. We're also highly focused on clients who require medication at a much more frequent basis. And I'm happy to report that 5 of our 6 providers for medication-assisted treatment for opioid use disorder are continuing to provide new assessments. And 5 of the 6 are taking new, and 6 of 6 are continuing to provide the services and treatment. Again, we're back to 211. They have a lot of the information and resources so that it's not just with our local providers, but it's also all the resources available. There are links for suicide prevention, for coping with anxiety, for mental health, including things like meditation and mindfulness. So we're continuing to try to meet the needs of the community at large, but paying very, very special and specific attention to our clients who have much more intense needs, including medication management and access to their psychiatrist and to their therapy. So so far, while the staffing has not been impacted, we are preparing for that event because once a residential program or crisis unit encounters a client or a staff person, then for quarantining and for taking some programs offline and for kind of shifting our capacity to different areas. But for the short term, it looks like capacity and the availability is pretty good, but we know that we're not even close to our apex. And so it is a kind of a day-by-day assessment. We reach out to providers 3 times a week to make sure that we're looking at any barriers they might have and to kind of problem solve some of the issues. So we're current on all the executive order requirements. We're current on any implementation or procedure changes so that we're not creating the wheel and getting the information out as quickly as we can. But we're very, very early into our eventual crisis. But I feel like staying on top of it, getting the resources out, having a really strong network of telehealth that we're prepared for whatever may come in the very near future.
Okay, thank you very much, Ann. I have a few more questions for Dr. Alonso, and then we're going to have Elisa to give an update for Sandrine and for the others who we can't seem to connect with, and then we're going to move on to Julie.
Okay, one of the very interesting questions was about the fact that we have more cases in Boca, whether could that be due to better financial resources and thus being able to test. Most of the testing that's been done many of these cases have been done through Broward. They've gone down to some of the testing sites in Broward, and then we get those cases up here because the cases are reported by the resident's home. So that's part of the testing there. But yes, obviously having more access to financial resources allows you to test not only here, but to test outside of the state. And some of the physicians and some of the folks, that is very possible. It also asked about, is the data, are the positive tests actual tests or are they extrapolated? These are actual positive COVID tests that come from the lab. So all the lab results come to the health department, and once they are come into our system, then we count those as positive. It's the responsibility of the doctors to report. So sometimes the doctors report it to us, but the labs are the ones where we get most of the reports back. There is a delay from the testing to the actual reports that come back to us, and now it's as much as 8 to 9 days, because the more these private labs are now getting tests, the more they are delayed. They started off saying that they could run them in 24 hours. Nobody's running 24-hour test results anymore. It has to do with volume. And the other question is Florida testing enough to know whether Florida is flattening the curve? We will be testing a lot more, but no, Florida's not testing enough, because I guarantee you in the smaller counties, there's no testing being done. And we know that there's more positive tests out there. My thought on this is that people should assume that everybody they run into is positive. We have to use the whole notion of universal precautions. That's why the social distancing is, again, so important. If you are just thinking that the people that are positive are the ones you have to worry about, you're going to get infected, because you're not going to be cautious for everybody out there. We're sitting here in this room and we're staying 6 feet apart from each other. When we go outside, we're doing the same thing. At press conferences, you've seen that I keep telling everybody, and I've even told the reporters, get your cameras away from each other. Stay 6 feet apart. We have to do that. If we don't do that, we're gonna become positive. So the testing will help us in order to get data, but it won't change a person's outcome and how they are treated or in how they need to quarantine and stay home. Okay?
Thank you. All right, we got a couple of more updates. Elisa, are you able to unmute yourself and give a quick update with DCF?
Yes, can you all hear me?
Yes, we can hear you.
Okay, so I'm sorry that Bobby Shea was not able to be understood presenting about child welfare. Our child protective investigations and our adult protective investigations are still fully operational. The hotline is still accepting calls, and we, of course, are trying to protect our investigators as much as possible, going out with PPE and screening at the hotline level when we do receive calls, if there are any illnesses in the home or any symptoms. We are also working, of course, very closely with ChildNet and the Children's Home Society here, also trying to protect our foster parents, our group home providers, and our partnering organizations. On the adult protective services side, likewise, our investigators are being very cautious with that very vulnerable population. We are seeing although the department does not investigate scams and fraud, we are seeing that there are multiple notices out in the community from law enforcement about a rise in those frauds and different schemes that folks are doing, different scams going on. So we just, caution everyone to share that information, to look out for it, to assist our neighbors and direct them to law enforcement and to the hotline. On the economic self-sufficiency side, we have a lot of policy adaptations that have been made to address this critical time. And I really, rather than go through them, I was hoping that Sandrine would be able to, because she is an expert in this policy. But they are laid out pretty directly on our website, myflfamilies.com/COVID-19/access. So there have been changes regarding the maximum monthly allotment that can be given to a household. The Department of Children and Families submitted a federal waiver to temporarily increase all SNAP recipients' benefit amounts to that maximum monthly allotment based on household size. And on our website, there is a chart that identifies what that benefit amount would be based on the number of people in each household. There also were changes made for recertifications. So that recertification timeline has been extended for individuals and families who were scheduled to recertify in April or in May. There is now going to be a 6-month extension implemented for SNAP, TANF, and Medicaid recertifications for 6 months. Also, there has been a waiver on the work requirements. And also, there has been a change in Medicaid eligibility that allows for current recipients to maintain their eligibility through the last day of the month of the state of emergency. So that means that no Medicaid recipients will lose their eligibility as long as we have this state of emergency continuing. So there are changes that are very important for families and individuals who are receiving benefits, and I encourage everyone to go to that website link. It's www.myflfamilies.com/COVID-19/access, ACCESS.
Okay, and we'll send that information out to everyone as well. Thank you very much, Elisa. We really appreciate it. And
thank you.
We're going to be following up on next week, talking about homeless children, and we're going to have some people from the school district who can give us an update on what's happening with homeless kids in this as the district transitions to virtual learning, because we know that there are going to be challenges there. So we'll appreciate the update, and we'll likely have additional discussion about homelessness, especially youth homelessness, in future meetings. Thank you. All right, so we're going to keep it moving. Julia, if you could unmute yourself, you're on deck now. So if you want to provide us an update on what our unemployment numbers are and some of the strategies that we are implementing to address reemployment.
Thank you, James, for having me today. It's all a lot of great information. So as you know, we came into this with a very strong economy and a 3% unemployment rate, almost full employment, and we just hit a wall. With this virus that Dr. Alonso was saying, where we have to socially distance ourselves, all the professions that require social interaction, like hospitality, restaurant, leisure, tourism, they stopped, and many people were laid off or furloughed. So to date, we have about 12,000 people who filed for unemployment in Palm Beach County alone, and 155,000 within the state. And that's with a system that has been completely overwhelmed and up and down in the last few days. They're working very hard on the unemployment website, but right now it's in active patience. There's a lot of businesses out there that are having a knee-jerk reaction to just fire their entire staff, and I beg you, please do not do that. There are so many options to bring people down to part-time, half-time. There are business loans that will allow you to cover for those costs now, and the government will be providing a lot of money for small businesses to stay open. CareerSource works with businesses, and we match talent with businesses, so we're very involved with all of the chambers. But right now, we're really taking a look at the people that are unemployed. We are not the unemployment office, but what we are doing is trying to facilitate some of the unemployment questions. Our staff are all working virtually right now, but they are answering almost 1,000 emails and phone calls a day for people who are just frustrated with the system. And I believe everybody is trying to help everybody here. We have a phenomenal community of nonprofits, and our county government is working very hard to help people with all this information. So again, I appreciate being on here. So if you've lost your job and you're trying to file for unemployment, the website that has all the information you need to know is www.floridajobs.org. There's some videos on there. Watch the videos, get all your information together before you apply. The longer you're online, it's another person is waiting for you to get offline, right? It's like a doorway that you're waiting for people to come into. So you need your social security number, your driver's license. You do need all the information about your previous unemployment. Even if you're partially unemployed, you have an option of applying for unemployment. So get all your stuff together and then go online, floridajobs.org. Then you'll see the videos, and then you'll see the website called Connect. Connect is actually where you log in and start your claim. Now, if you're logged out by accident or you forget your PIN, there's a FAQ page that you'll see on this slide. It's in the upper right-hand corner. That FAQ page will actually show you all the telephone numbers or, again, information that you need to log back in or find your PIN. That seems to be a huge problem right now. Patience, patience, patience is all I can say. Filing for unemployment right now is a job, and the state is working very hard on it. And the reemployment system is just overloaded right now, so be patient. CareerSource has jobs. We have 800 postings of jobs, but there's job boards all over the internet, so feel free to just find something. Right now, jobs that are available are really delivery services, IT, healthcare, all your local stores that are open need people to stock and clean. Those are jobs that are open. Our doctors and nurses are getting overwhelmed, but we have a lot of medical assistants in doctors' offices that have, been cut down in hours. And so they can go find additional jobs helping out in different locations as well. A lot of telework is happening. People are working from home. So a lot of IT jobs are opening up now as well. So you're going to see a different change in the workforce coming up. I think businesses are going to work tighter and they're going to work smarter. You're going to see a lot of nonprofits helping out as well while we recover. But we do anticipate that while we've had a huge spike in unemployment, and because season has ended, the spike has been harder. But we're going to go back into season. And this morning we were online with Discover of the Palm Beaches, and all the hotel and tourism industry is pretty optimistic that we'll be opening up and the rehiring will occur. So this is a short blip in time. It is hard. I'm not going to sugarcoat it. It is hard for a lot of people and businesses. So there is help out there. A lot of business loans that start very shortly. Money is coming down from the government for them. That all is online. If you go to careersourcepbc.com, we have all the links to help you, whether you're a small business or whether you're unemployed. So I hope that you take advantage of those resources and all of our community partners as well. So thank you very much.
Thank you. Thank you very much. All right. And our last presenter will be Julie Kriepel. She's going to share some information about how we're maintaining food for our most vulnerable residents. Julie?
Yes, hi, good afternoon, everybody. I know it's been a long webinar and with lots of great information, so I'll try to keep it short, but at the same time, very informative. So Hunger Relief with United Way of Palm Beach County and all our community partners, including the county, have been coordinating food distribution with Palm Beach County Food Bank, Feeding South Florida, the Area Agency on Aging, and approximately 80 food pantries that are still operating throughout the county. We've had about 41 close as a result of folks being concerned with social distancing and the pandemic. My team and I are the central point for contact for businesses, faith-based organizations, and anyone else who's interested in donating or distributing food during this crisis. Children and families can access free meals for kids 18 and under at more than 60, they're called break spot grab and go sites. With the schools being closed, the state opened up an opportunity for children to pick up meals or their parents to pick up meals for them at school sites, 35 school sites. Flippany, which is a sponsor for the Summer Break Spot program, is working at about 15 sites that we help them identify deeper into the communities for folks who might have challenges getting out to the schools. There are also locations at the Boys and Girls Clubs where families can pick up meals, and some others that you can access sites to see what's closest to people's place of residence by going to summerbreakspot.com. I sent the links. James has those so that he can share that with everyone. They can also text FL Kids Meals to 211-211 or call 211 to find out where those meals are. Boxes of food are being distributed at the school sites, the 35 school sites, by Feeding South Florida. That's 1 day a week this week. Next week, they're taking a break from doing that, but the meals will continue at the schools. We send the schedules out for where these meals are at which schools, also with Flippany, and also the Boys and Girls Clubs will be added this week. Palm Beach County School District's website also has a wealth of information on there. They post everything we give them in addition to us getting it out to the community. This Friday, tomorrow, families in the Glades will also be able to get a weekend backpack kit. Thanks to Pan Florida Challenge, we have a family weekend backpack program with them when school is in, and we've been able to organize it so that the children can get their family weekend backpacks at 5 different elementary schools in the Glades and also at South Grade Elementary and Barton Elementary in Lake Worth tomorrow. Seniors who are in need of food should contact the Elder Hotline or Helpline. That's 866-684-5885. And Palm Beach County senior centers are still being used as distribution sites. PalmTran delivers the food to homes of seniors. So they basically have that all working pretty much like a Swiss clock. They kind of did their delivery services a little bit read in reverse, so the seniors don't have to come out. They take those meals to their homes and they have meals for 2 weeks, and then that's repeated so that they're never without food. And those are folks that are within their service array, folks that are on the waiting list. They're working on servicing, and they're also working on some out-of-the-box models to get food to seniors who are self-quarantined. I hate to say shut in, but I guess they are, and unable to get out and go shopping or have someone to shop with them. So we've been working very closely with Dwight Chenette and AAA to come up with some alternatives and partnerships that might work out well for them. And then all other individuals who are in need of food should contact 211. They get updates about the pantries. We're working with the county with their community services link on their website to show all the pantries that are open and their hours and their addresses and phone numbers. And one more thing about the meals for the kids, those are free for anybody 18 and under. So they don't have to be school age kids. They don't have to qualify. If somebody's an ESE student, the age range there is under 22. And again, those break spot meals are regardless of financial need. And they just came out with a new waiver this week that the parents do not have to bring the children to the sites. They can bring proof that the kids are in their family or enrolled in the school or in their family and pick up the food that way.
Thank
That
you.
is pretty much my update, James. Anything else
Thank you
that
very much.
I can help with? You're welcome.
All right, and we'll get those links out to you. These slides will be available after the webinar, and we will be posting this webinar to the website, so you'll be able to listen to the earlier parts if you logged on late. Julia, I would like to if you could just once again talk about any trends or issues with employment or unemployment in the healthcare industry that we should be paying attention to? Like, are the resources there? Are they still there or to assist with the COVID-19? I can talk a little bit about the resources.
I was going to say,
And is there anything we can do to ensure that the needs of the workers, the healthcare workers, are being met? I'll talk a little bit about that as well. If you can speak to trends.
I think, as a nurse myself as well, I think that we always have to protect our frontline staff, our doctors and nurses, firefighters and policemen. And, actually our county mayor is a former police officer. So I know that the county is very sensitive to the care of our frontline staff and that they take care of them during this time. We have not seen a huge increase in healthcare job orders, but we have seen an uptick in maybe behavioral health techs being required, but not to an alarming event like, oh my gosh, we're short-staffed. It's just supplemental staff. We've seen a lot of doctors' offices kind of cut back on their staff hours because they have done a lot of telemedicine now. They've moved into a new phase of providing services virtually for their clients. So that is an interesting twist to this, but not actually seeing any resource problems yet.
Okay, very good. And I know that there is still a shortage of PPE, the personal protective equipment. That is certainly an issue. And we are, as we order additional PPEs, we are very strategic in how those are allocated. We know that our hospital and emergency rooms need to have that equipment. We know that as we are doing some of the critical services that we absolutely need to be protecting ourselves, even if it's talking about delivering food, making sure that we have gloves and masks, because you can try to do a good thing by taking food to people or handing food to people, but if you're not using gloves or masks, you can continue to spread the disease or the virus. And that's not what we want. We want to take every measure as possible to ensure that we're slowing the spread. And so PPEs is really a hot commodity right now. And we're being very strategic in terms of how it's allocated. So we know that some of you that are either still coming to work or those of you who are providing services are short PPE. So you're gonna have to take the protective measures to protect yourself and others. We've heard about some makeshift use silk. Dr. Alonso talked about using silk as a garment that you can put over your mouth, and it works just as well as some of the masks that are out there. So I think that's very important as well. Julie, you have something else you want to add?
Yeah, thank you, James. Notice that somebody asked a question if families are provided information on local pantries when they go to the school site. And I don't think that something is printed out there, but they can access it online. But that's a really good point. So I'll get with the school district and the other sites and see what else they might be handing out, because we do share a lot of information with them on a regular basis of what is the latest thing, items happening, whether it's related to joblessness or SNAP or whatnot. So as far as the local pantries, I'll be sure that that's included. I really appreciate that comment. And then I also wanted to just remind everyone that United Way of Palm Beach County is taking financial donations on our website. Volunteers can sign up on our website. We get a lot of requests about that, and they can go straight to the website to do that. And any nonprofits that are affected by COVID, which I know is many, they can apply for a grant directly through our website with our or through our joint funders application. I want to make sure I mentioned that too. So thanks for that.
All right. Very good. Thank you very much. Really appreciate that. Any other questions or comments before we end this call? You can type those questions into the chat box. And if you have questions, one of the things that we want to make sure that you know is, we're still abiding by the 14-day isolation rule, but the CDC has now changed it to 7 days, but we're still taking measures to be extra careful. And how do you know if, in fact, you're okay to to start engaging again. It's based on whether or not you are continuing to have symptoms. So if you're still, and you want to make sure that you check in with your healthcare providers before you can continue to engage. If you're still having fever, cough, shortness of breath, you certainly want to stay in any of those symptoms. But ultimately, your healthcare provider should provide you with the okay to engage with whatever critical and essential services you need to engage with. Any other questions? Yes, we will send the slides out so that you'll have access to them. And there's a question, will the soup kitchens suffer closure? Julie, that might be a question for you in terms of the soup kitchens suffer closure. I'm not quite sure.
Yeah, I'm not sure what that question means, but I can tell you that I just found out last night that the soup kitchen in Boynton Beach, right next to Caridad Center, needs additional supplies of food. So I've contacted Feeding South Florida to see if they can help us with that and what their capability and bandwidth is. And certainly anybody that we hear about, please send them our way. We'll connect them either with them or the Palm Beach County Food Bank or to make sure they have what they need. I haven't heard about any soup kitchens closing, but that doesn't mean that they didn't, but I haven't heard about any. But I do know that particular one needs additional food that we're working on. But anything like that, please pass it my way. Any questions, email me or give me a call.
Okay. All right. And I see that someone mentioned that Silo is still operating, which is good. And the Curing Kitchen in Delray is still providing to-go meals in Delray Beach public parking lot. Julie, did you mention anything about Feeding South Florida? Do we know if they're standing up a feeding site at Gaines Park tomorrow?
I still haven't heard. I talked to somebody else today to try to get an answer on that, and I don't have a definitive answer at all yet, James. I'm working on it though. As soon as I know, I'll let you know.
Okay, and we'll certainly share that information with you as well.
Thank you.
So I see a couple of other comments coming across the chat. I don't see any questions. What time will the backpack meals be distributed at South Grade and Barton Elementary Schools? Julie, if you have that question, you can answer it, but if not, we'll have to get that information to you.
I do know. It should be between 11 a.m. and 1 p.m. And we had the school district posted it on their website as well, so they can check there, but that's the latest and greatest from yesterday, 11 a.m. to 1 p.m.
Okay, very good. It's also important to note that youth services, the youth and family counseling, that they're still providing remote counseling services for any youth up to age 22. That's important. During this time of crisis, people are very uncertain about how to move forward, and it impacts people in different ways. So if in fact you need to access remote counseling services, you can call 561-242-5714. Again, that's 561-242-5714, and you can access remote counseling for youth or families. And in terms of, there's a question about where in Delray and Boca Delray will the second site be, and who will be running it, if not the healthcare district. Dr. Alonso did have to step out, but they were looking at we don't know exactly where it's going to be. We just know that we want to have one down south, so we'll keep you posted for that. And then how can you find individual city data on the Florida Department of Health interactive chart? There is a report that you can run. If you go about halfway through, you'll see two tabs where it talks about different reports. If you click on that report, you should have city data there. And then we're also tracking city data as well. So just for Palm Beach County. So that graphic that you saw earlier that showed deep purple for Palm Beach County was actually a graphic that was made by a community services staff, Stacey. And so if you would like access to that, I believe that might be available online. We'll send that link out as well, and you'll be able to get more information using, that's a Tableau report on or GIS report on city data. But that is available on the health department site, and it's available. We take that information and we use the GIS map to create heat maps yourself. And what jobs are hiring that people can apply for besides IT position, Julia? That might be a question. I think you mentioned that briefly before in terms of what jobs are hiring, but if you want, there's a question about that if you want to take that.
Sure. Jobs that are hiring right now, we have security, we have some healthcare, IT, which I know you asked not to, but warehousing, delivery, distribution. If you go to any of the Workforce Board websites, they'll be listed there. We also have a YouTube channel where we're listing them, and they're actually listed directly on our website, WPBC, careersourcepbc.com or employflorida.com.
Thank you very much. And I don't see any additional questions, and it looks like we're turning the corner on 4 o'clock anyway. So I just want to remind you that we'll host these weekly webinars every Thursday at 2:30. We moved the time back so that we could accommodate a 1:30 webinar by the Florida Housing Coalition. They're organizing around housing and some of the dollars, and we want to make sure that many members of our Homeless and Housing Alliance and others have an opportunity to participate on that call. If in fact you want to get these webinar invitations directly, then you can either maybe email, I hate to say email me because it's already, I have a lot of emails, but we'll send out some information and hopefully you'll be able to, well, I tell you what, you can email Lashana and just have her add you to the list. And I'll give you Lashana's email. Give me 1 second. She's gonna kill me, but okay. But if we don't have the email address, it may not. So you can email Lashana at lmitchell, LMITCHELL. It's LMITCHMELL at pbcgov.org, and we'll add you to the list so that when we get the invitations in the future, or when we send them out, you'll get it directly. But we'll also make sure that we're sending it out to our Birth to 22 partners, to our Citizens Advisory Committee, Homeless Housing Alliance, all of our financially assisted agencies and others. And you'll get that. We'll add that information, a link on our CSD website as well, so that you can kind of add your email and get these updates. But that's going to conclude our call. We appreciate you coming on and presenting, all of the presenters. We really appreciate you taking the time to share that valuable information. And we'll see you next Thursday at 2:30. Thank you.
Thanks, James.